Or we could all like side by side. Do you know what muscular dystrophy is?
No.
What do you think it is?
Muscles that don't work.
Caitlin, do you know what muscular dystrophy is?
No.
What do you think it is?
When your muscles don't work. I don't know.
All right, Jordan, could you please tell me what you think muscular dystrophy is?
I believe it is like muscle weakness or something like that. I'm not really sure.
Good job, good job, good job.
Caitlin, do you know what muscular dystrophy is?
I think it's like a genetic disorder where you lose muscle mass.
Oh my God, good job.
Thanks! Do you know what muscular dystrophy is?
No.
What do you think it is?
When your muscles dystrophize.
Good job!
Hey Lauren, do you know what muscular dystrophy is?
No, I don't.
What do you think it is?
I think it's when your muscles deteriorate or don't function properly.
Yeah.
Welcome to Night News Now. I'm Caroline Fessler.
And I'm Emma Christensen. Tonight for our Medical Spotlight series, we will be highlighting a disease known as muscular dystrophy.
Muscular dystrophy is a genetic disease that damages the neuromuscular system and leads to weakened muscles, poor coordination, and overall decreases quality of life. As of now, there is no known cure for muscular dystrophy. This disease involves a lack of the protein dystrophin, which is what causes problems with walking, swallowing, and muscle coordination.
Muscular dystrophy can affect a variety of populations, but it is normally diagnosed during childhood. Most cases result in atrophy of muscles over time, and many patients end up requiring a wheelchair to perform day-to-day activities.
Though there is no known cure for muscular dystrophy, there are a variety of treatments to help lessen the effects of the disease. Treatments include physical therapy, cardiopulmonary rehabilitation, medications, and in some cases, surgery to correct skeletal or heart problems. Muscular dystrophy is an X-linked disease where one or more exons are missing within the gene. This prevents the remaining exons from fitting together, which is what causes a lack of the protein dystrophin.
Mothers can transmit this disease when the mother is unaffected. For a daughter to inherit muscular dystrophy, both X chromosomes from the mother and father must have this gene defect.
Now we will view a video from a community hospital explaining common signs and symptoms of muscular dystrophy.
The main sign of muscular dystrophy is progressive muscle weakness. Specific signs and symptoms begin at different ages and in different muscle groups depending on the type of muscular dystrophy that you have. Frequent falls and difficulty rising from a lying or sitting position, trouble running and jumping, muscle pain and stiffness, learning disabilities, and delayed growth are all signs and symptoms of muscular dystrophy. Muscular dystrophy occurs in both sexes and in all ages and race. People with a family history of muscular dystrophy are at a higher risk of developing the disease and passing it on to their children.
And now we'll cut to Sarah to explain the different types of muscular dystrophy.
Hi, my name's Sarah, and there are 9 different types of muscular dystrophy, the most common being myotonic muscular dystrophy. This can include prolonged spasms or stiffening of the muscles after their use, and this typically occurs in colder regions of the world. Overall health concerns can include muscle weakness and damage to the CNS, heart, gastrointestinal tract, eyes, and hormone-producing glands. This can lead to a decreased life expectancy. 2 other different types are called Becker's and Duchenne's. Both worsen more rapidly than myotonic, and they affect skeletal muscles. They both can occur more commonly in males, where symptoms begin early in their childhood and then become more severe during early adulthood, which ultimately leads to death. In Becker's multiple dystrophy, symptoms are more milder and more varied than when it comes to Duchenne's. Both can cause irregular heartbeats, shortness of breath, fatigue, and swelling of the hands and feet. In Becker's, patients typically live until their 40s, while in Duchenne's, they only live until they're in their 20s. And now on to our other reporter, Riley, who will talk about the next 3 types of muscular dystrophy.
Hi, my name is Riley, and I will be talking about 3 more types of muscular dystrophy. Limb-girdle muscular dystrophy is typically developed during the teenage or early adulthood years. Signs and symptoms of this one include progressive weakness that begins in the hips and eventually moves to the shoulders, arms, and legs. Within 20 years of being diagnosed, walking will become nearly impossible for the patient. The life expectancy of patients with this form of muscular dystrophy will typically live into their middle or late adulthood years. Fascioscapulohumeral muscular dystrophy also is developed during the teenage and early adulthood years. This type specifically targets the muscles of the face, shoulder blade, and upper arm. The symptoms are slow progressing and contain short periods of rapid muscle deterioration and weakness. The severity of cases can range from mild to completely disabling, and about 50% of patients can walk throughout life and live a normal lifespan. Congenital muscular dystrophy is also slow progressing and has 2 different types. Congenital muscular dystrophy with myosin deficiency causes muscle weakness at birth for the first few months of life. Fukuyama congenital muscular dystrophy causes abnormalities in the brain and can often lead to seizures. In severe cases of both forms, shortening or shrinking of muscles can lead to joint problems. And now you'll hear from Allie for the last 3 types of muscular dystrophy.
Hi, I'm Allie, and I'm going to talk to you about the last 3 types of muscular dystrophy. Oculopharyngeal muscular dystrophy affects the muscles of the eyes and the throat. This mostly affects men and women in their 40s, 50s, and 60s, and this type is slow progressing and causes weakness in the eyes and facial muscles, which could lead to difficulty in swallowing. Choking and recurrent pneumonia is very common with this type of muscular dystrophy. All right, we have distal muscular dystrophy. This affects men and women, and this causes weakness and wasting of distal muscles. So this would be your forearms, your hands, your legs, and your feet. This type is generally less severe in slow progression compared to others, and it also affects fewer muscles than other forms of muscular dystrophy. And finally, we have Emery-Dreifuss muscular dystrophy, which is an extremely rare form, but it appears in children and early teens. This type mainly affects males, but in rare cases has been seen to affect females. This causes weakness and wasting in the shoulders and upper arms, lower legs, and it is common to see life-threatening heart problems with this type of muscular dystrophy.
The diagnosis of this disease starts with a normal medical history and physical examination. Next, several blood tests are performed, such as an enzyme test. Tests will specifically look for creatine kinase, which is released when muscles are broken down. If there is creatine detected without a traumatic muscular injury, this can indicate muscular dystrophy.
Another blood test that can be done is genetic testing. Blood samples are taken and then studied for possible gene mutations. A muscle biopsy can also be performed to analyze muscle tissue and look for signs of muscular dystrophy.
Electromyography is another diagnostic tool where an electrode needle is inserted into the muscle for testing. Ow!
When a patient is diagnosed with muscular dystrophy, their care team should include a neurologist, a physical medicine practitioner, physical and occupational therapist, as well as a cardiologist, endocrinologist, and an orthopedic surgeon. It is very important to emphasize that individuals with muscular dystrophy will need this care team for the remainder of their life.
Currently, there is no cure for any form of muscular dystrophy. A patient's life expectancy can be extended with proper care and medication. Aside from frequent checkups with specialized physicians, medications such as corticosteroids, eteplirsen, glucodiazepine, angiotensin-converting enzyme inhibitors, beta blockers, and Amondes 45 injections are all proven to increase life expectancy. Also, exercise therapy can help improve range of motion and keep joints flexible. Low-impact aerobic exercise will help maintain muscle strength, mobility, and general health. All patients should consult with their physician prior to beginning exercises. Braces can be worn to keep muscles and tendons stretched and flexible. Patients may want to consider mobility aids such as canes, walkers, and wheelchairs. In rare cases, surgery can be performed to correct contractures or spinal curvature.
Earlier this year, scientists at the UT Southwestern Medical Center have advanced in a gene editing technology called CRISPR. CRISPR technology has the ability to edit genes, and it functions like a spell checker for DNA. Researchers are able to program it to find any misspelled genes. It slices through specific sections of the DNA, and it has the ability to disable a malfunctioning gene or insert new genes to restore its function. CRISPR stands for clusters of regularly interspaced short palindromic repeats, which essentially consist of the building blocks for DNA. They are then separated by spacers, and a virus containing CRISPR components is then injected, and a molecular GPS is deployed directly to the region of the gene that needs to be edited. It has been able to stop the progression of Duchenne's muscular dystrophy in animal and human cells, and it has been estimated that with just 15% of improvement in dystrophin levels might greatly benefit humans that suffer from DMD.
If you or a loved one is or has experienced signs and symptoms of muscular dystrophy, please contact your physician immediately. Do not contact us. We are simply college students just trying to graduate.
The symptoms.
The symptoms!
That's so funny.
Hi, I'm Allie, and I'm going to talk to you about the last 3 types of muscular dystrophy. We have That ain't it.
Just say it out loud first, so don't videotape it.
Okay, I won't.
Okay.
Detected without a traumatic muscular injury.
Sorry. This happens in men and women in their 30s, 40s, and 50s. Nope, it's their...
The life expectancy.
Becker's
Muscular dystrophy, I can't.
Fukuyama congenital muscular.
What?
I don't know, for me, like, the legs are like the lower part of your body, so why would you say lower leg? Unless you're talking about from the knee down.
Isn't that what they're talking about?
Is that what that is?